Now, COVID-19 infections are raging across the world with no sign of slowing down. The number of accumulated cases are approaching 25 million, with over 830,000 deaths, according to Johns Hopkins University. And most of us are pinning our hopes on the news of a vaccine or an effective treatment that can finally bring us hope of soon ending the pandemic. But at the same time, there are also concerns that the pressure to quickly develop a cure or treatment is speeding up the process at a pace that might not be so beneficial for us in the long run. We discussed this today with Dr. Bruce Y. Lee, who is a professor of health policy and management at City University, New York. He is also a systems modeler and a senior contributor for Forbes. It's lovely to see you again, Dr. Lee.
Great to be here. Thanks for having me again, Sion.
Thank you. And well, my first question to you, Dr. Lee. The US Food and Drug Administration over the weekend granted an emergency use authorization for the use of convalescent plasma as a treatment for COVID-19. So first of all, what does this treatment entail?
So it's basically taking the plasma, which is the liquid portion of the blood of people who have had COVID-19 and have recovered from COVID-19. So convalescent means recovered from a disease. And that plasma, that liquid portion of the blood, should have antibodies, so antibodies against the virus. So if you take that plasma from a patient who's recovered from COVID-19 and then give it to someone who is currently infected with COVID-19, then those antibodies may help neutralize the virus, or at least slow down the spread of the virus until the person who's currently infected can mount an immune response to the virus. So it's basically taking antibodies from someone who's recovered, and the antibodies are in the plasma, and injecting that into someone who's currently infected.
And this treatment, President Trump and FDA Commissioner Stephen Hahn cited a study that claims that the plasma reduces mortality by 35%. But what do we know so far about the effectiveness of blood plasma to treat viral infections such as COVID-19? And can it really be called a breakthrough as the Trump administration is making out?
Yeah, so the concern during that announcement was, first of all, the 35% is not an absolute reduction in risk. It was actually a relative reduction in risk. And a lot of scientific and public health experts questioned that statement. And Commissioner Hahn subsequently on social media reversed and stepped back and said, yes, that's true. It's not an absolute reduction. It's actually a relative reduction. And no, this is not a big breakthrough. This is just a step, it's a change in terms of the availability of this treatment. The problem or the question is there hasn't been enough good quality studies that have been done evaluating this therapy or this potential treatment. The studies to date have been very limited. So in some cases, there haven't been enough patients, or there have not been adequate controls or comparisons. Or there hasn't been randomized clinical trials either to really evaluate this treatment. So the jury's still out in terms of how safe and effective it is. So there's a lot of concern expressed that this emergency use authorization came too early, that we still need to learn a lot more about this potential treatment before we can deem it effective and safe.
Well, it does seem rather worrying, even for the average person, seeing that what should be a scientific decision isn't really being backed by science. And while the FDA's decision has triggered a lot of concern in the medical community, as we can see, but are scientists like yourselves then seeing this as a rather political decision?
Yeah, that's the big concern. So I, as well as many other public health experts and researchers and scientists, are concerned that this is a more political decision rather than a scientific decision. Because, again, if you look at the actual data, the data suggests that there is potential and there's potential promise with this treatment, but the studies have been very limited. And so we need more information before we can deem this an effective and safe treatment. And good science takes time to do. So rushing a treatment brings significant risk and potential significant problems. So we have to be very careful about this.
Right, and what could actually be the implications of shortcutting regulatory procedures and skipping the data collection process?
So the purpose of the FDA, the Food and Drug Administration, is really to protect the public because there's a lot of people trying to develop different types of potential treatments. And, you don't want a situation where a treatment reaches the public too early and there are safety issues. So that could actually harm people rather than help them. So, when you're actually delivering, you're taking plasma from one person and giving it to another person, that's not without potential risk. There could be potential side effects. So you really have to determine, what's the probability of these different side effects. Everything has risk, and you don't want to give something to people if it could potentially hurt them and not help them. The other risk is that, say this is reasonably safe. If it's not effective, then it could give people false hopes. So they might think that, this treatment will actually help me, and therefore then I don't have to take the same precautions, or I can have false expectations. We're really concerned that if people think that there's an effective treatment out there when there isn't, that they may not do things like social distance, or they may not, wear masks, or they may not take appropriate precautions. So before something is deemed an effective treatment, it has to be proven an effective treatment.
Well, not only just effective treatments, but there is a lot of pressure on quickly developing a coronavirus vaccine. And we're starting to hear this a lot in daily life when a vaccine is developed. I will go traveling again. When a vaccine is developed, the pandemic will end. So with the fast tracking of treatments like the plasma treatment that was authorized earlier this week, do you think there's a chance that coronavirus vaccines will be rushed in a similar fashion?
Yeah, that's a big concern as well, a very, very big concern. Our team did a study that was recently published in the American Journal of Preventive Medicine, where we developed a computer simulation, and we showed that for a vaccine to actually stop the pandemic to a degree where you don't have to do social distancing, the vaccine has to have an effectiveness or efficacy of at least 70 to 80% or more than that. So that's a fairly reasonably high threshold. So if you think about it, the seasonal flu vaccine tends to have an effectiveness ranging from 20 to 30% up to about 60% or so. So this would be higher than that. And so first of all, just because a vaccine comes out does not mean it's going to necessarily stop the pandemic. And you don't want a situation, same with a treatment, where you're rushing a vaccine that may not have been adequately tested in terms of safety and effectiveness. So what happens if you get a vaccine out there and it has side effects and actually starts endangering the public? Or it's not a very effective vaccine, but people think it is effective, and then they then don't do social distancing anymore. They don't wear masks anymore and things like that. So it could be potentially disastrous if you were to rush a vaccine. So we really, really, really need to be very careful about this. And rushing a vaccine for political reasons is a terrible idea. It can cause a lot of damage if that happens.
Well, unfortunately, we are seeing that across the world, just political leaders pressuring scientists, I suppose, and even blaming them in some instances for the slowness of developing treatments or vaccines. But, well, here in South Korea, some experts have recently said there actually is no guarantee that a vaccine would be more effective than even masks, because vaccines for respiratory diseases such as COVID-19 generally don't obtain the complete effectiveness seen in vaccines for other conditions. So would you agree with that statement?
Yeah, absolutely. In terms of our study, we showed that it has to have a fairly high effectiveness and efficacy, and achieving that level is not going to be easy. We do see the effectiveness or efficacy of vaccines ranging quite significantly. But if you look at respiratory viruses, it's not easy to develop a vaccine that has high efficacy. So we have to keep in mind that even if a vaccine doesn't have that high level of efficacy, it still could be useful, but we need to set our expectations correctly. We can't assume that once a vaccine comes out, then we can abandon all the other public health measures. immediately. So everyone's expectations need to be set appropriately.
Right, so we really shouldn't get our hopes up, without scientific ground to really back it up. But I think we're not getting a lot of that really all around the world. And well, here in South Korea, it seems like we're experiencing a second wave of COVID-19 infections. And there's been a surprisingly large number of young people being affected this time around. And of course, young people tend to be a little more complacent about COVID-19 because they believe they'll come out of it stronger, and also they might possibly be asymptomatic. But a study has recently shown that even asymptomatic patients could have long-term health implications. So what are some risks that people who aren't experiencing symptoms might be susceptible to?
Yeah, we need to keep in mind that no one has immunity to this virus. And even though there might be some people or certain groups of people with higher risk for worse outcomes or worse problems, we're seeing significant health problems in all different ages. So no one is, quote unquote, safe from the virus, and everyone can catch the virus and be contagious and spread the virus to others. So we're seeing many situations in which, so initially, it was thought the two major complications of the virus was lung damage from pneumonia and ARDS. So people can have persistent lung damage from that. Or if people develop sepsis, so that if the virus gets into the blood, they can develop organ failure and have organ damage. But now we're seeing a wide range of different possibilities. So we're seeing people having blood clots, or people having neurological damage to their nervous system, or having persistent issues in terms of, feeling anxiety and other issues. So we're still learning a lot about this virus. And so just because you don't have some of those major lung problems initially, or you don't develop sepsis, you can still have a variety of issues. And we're seeing a whole class of people that are being called long haulers, quote unquote long haulers, because they have these persistent symptoms that last way beyond the first few weeks of the infection. So we're learning more about the virus, and everyone has to keep in mind that everyone may be susceptible to these long-term effects.
And here we're seeing the second wave of infections, and we're becoming very worried about a possible third or even fourth wave as we go into fall and eventually winter. So why is it so important to curb the infections before it hits fall or winter?
One of the big concerns is that this virus may still have what's called seasonality. So if we recall back in the spring, people were wondering, will the transmission of this virus go down during the summer? So when the weather maybe gets more humid, just like the flu virus transmits less in the summer, but then as the temperature changes, or maybe the air grows less humid, you start seeing transmission pick up in the fall and the winter. So now that we've been through a fair amount of the summer, maybe transmission might have dropped. It has continued, but it may have dropped. Now when we reach the fall and the humidity changes, then what happens if the transmission picks up again? So then, we're in a situation where the virus is still spreading, but then it can spread more efficiently because the seasons have changed. So we could see a lot more problems. And, the season's changing. There's many different theories on why the transmission of respiratory viruses may pick up. And one of them is the fact that the air is drier. But also people are spending more time indoors. And we have to remember that there's also the flu season that may come as well. So lots of concerns about things getting worse when it comes to fall or the winter.
Right, and well, it's been nearly 6 months since the WHO declared COVID-19 a global pandemic, and obviously many of us are just itching to go back to return to our daily lives and our daily routines. But as you mentioned, there are so many things we don't know about this virus at this point, and we're learning more and more every day. So really, we can't be complacent or just slip from being, vigilant. Well, we'll let you go now, Dr. Lee, but thank you so much for joining our show again. And That was Dr. Bruce Wiley, Professor of Health Policy and Management at City University, New York, also a systems modeller and senior contributor for Forbes. You can find Dr. Bruce Wiley's articles on Forbes to keep up with the latest health issues and developments regarding COVID-19. Well, thank you again, Doctor, for your insights today.
Thanks, Yoon. Thanks for having me.
And to our viewers, thank you for watching. We'll be back on Monday, Korea time. Have a lovely weekend wherever you are. Goodbye.